Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked?
Rattlesnake bite. On a 2-year-old. Patient and dad out in the fields near a small town that is several hours away from the nearest big city, where I work. Dad takes the child to the ER in the small town with an obvious snake bite. Doctor there says, it's okay, she probably didn't get envenomated. Doesn't give the patient antivenin, which they had at that hospital, and instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later, patient shows up to our hospital coding and ended up dying. Probably didn't get envenomated? What the fuck kind of stupid idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means antivenin, physiological support, etc. Completely absurd.
Please tell me they sued.
During my residency, we had this lady in her 60s who was getting progressively more forgetful, just overall declining and getting less and less able to take care of herself. She had been seeing her PCP who diagnosed her with dementia. And she saw a neurologist who agreed. She was not really able to provide an accurate history. After talking to her family and friends, it became apparent that her symptoms were progressing unusually quickly. I remember seeing the point where her new hair growth met her bright red dye and also her grown-out nails with hot pink polish, thinking, wow, it really wasn't too long ago that she was not only taking care of herself but going to get her hair and nails done. The lady in front of me was so far from that. The neurologist I was training with recognized this, had her admitted and did every test including lumbar puncture. Workup eventually showed Creutzfeldt-Jakob disease, mad cow, which there is unfortunately no treatment for. She died a few months later, but at least we were able to prepare her family that she would only continue to decline so they could make arrangements. Really sad situation.
I'm the patient, but it's an important story to tell. From the age of about 17, I start getting regular abdominal pain every day and terrible gut problems. I can't seem to eat much anymore. I get fluctuating diarrhea and constipation. Menstruation gets more and more painful. I start losing enormous amounts of blood despite being incredibly small, less than 5 feet. Now you would think any doctor worth her salt could figure out it's a gynecological problem. But my doctor, a woman by the way, at the time insists it's anxiety, and says she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years, my gut and uterus symptoms slowly deteriorate. I get bounced around the system to dozens of different specialists. I get told it's just stress, anxiety. Are you pregnant? Are you you're not pregnant. Every woman has painful periods, it's just constipation, take this over-the-counter product, etc. etc. Meanwhile, my gut function slowly grinds to a halt. A functional gut test took 6 hours to pass an egg sandwich, when it should have taken 90 minutes. I weighed only 40 kilograms. It gets so bad I even start losing bowel control. No treatment seems to work. I was 24 and unable to work, because I was literally uncontrollably *ting my pants. Doctors suggest I should maybe seek therapy, and suggest I could be exaggerating. Anyway, one day I see a new GP for some regular sexual health tests, but get an abnormal pap smear. Within 2 weeks I go in for an exploratory laparoscopy to rule out cervical cancer, only to discover I am absolutely riddled with endometriosis. On my bowel. On my cervix. On my perineum. On some ligaments. Ovarian cyst the size of a tennis ball. It was even in my gallbladder. With excisions plus treatment, I had my gut function back within 3 months. I will never be able to have children. If that woman when I was 17 had just done her goddamn job, I wouldn't have lost 7 years of my life, my gallbladder, my fertility, and my mental health.
He put the pacemaker lead in the subclavian artery and across the aortic valve into the left ventricle. The proper approach is subclavian vein to right ventricle. And then he didn't notice it for over a year. I saw the patient, a 25-year-old woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead. Then replace the aortic valve. Totally inexcusable. Well, 50% of doctors are below average, but everybody thinks theirs is in the top 10%.
Neurologist sent patient to our ED without informing her that imaging showed a glioblastoma, assuring her impending death. He didn't overlook the disease, he overlooked the communication.
He just sent her over for you to do the dirty work of telling her she was dying. Geesh.
That is the shittiest thing one doctor can do to the next.
Now imagine you're a nurse that just read the diagnosis in the chart, and as you go to educate the patient on management or meds, the patient says, "I have what? Let me call the doctor. Giving a diagnosis is way above my pay grade."
This is so common. I used to work in maternal fetal medicine, and every single week, we would have women referred to us because the doctor couldn't see something clearly with the baby and wanted to double check. Nope, they just didn't want to have to be the ones to tell you that your baby had a complex cardiac defect or multiple anomalies indicative of a genetic syndrome or any other of a large number of horrible things that can happen during fetal development. Still pisses me off when I think about how many women waited weeks for more information because their doctors were cowards who couldn't tell them, "There's something seriously wrong here. I can't see it quite clearly, didn't sound serious, so the appointment wasn't made with any urgency, and now you're 24 weeks pregnant with a fetus that will not survive infancy and have no options but to carry to term and hope for a quick and painless death shortly after birth."
That's just terrible. The doctors can't change the prognosis of these cases, but the least they could do is tell the mother early on so she can decide for herself whether to carry to term or abort, since many places don't legally allow abortions past a certain point in the pregnancy, I believe about 21 weeks, since that's the point of viability.
I'm not a doctor, but a RN. This happened to me, but isn't nearly as bad as most of the stories on here. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing, progressed to me having to swallow bites of food multiple times / regurgitating it, and then got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times, and was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, was only 120 when this started, and was just generally miserable. Finally, my grandma was tired of watching me be sick all the time, so she called the GI doctor herself. They said we needed a referral, but she explained the situation, and they got me in the next day. Did an endoscopy and my esophagus was 95% occluded, the gastroesophageal sphincter. For some reason, some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information, and she had told them it was acid reflux and basically I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors. Fuck that bitch. Was not a fun year.
Not a doctor, but I had a half-assed dentist. I went to a dentist's office for several years and was repeatedly told to get braces and have my wisdom teeth removed. Both of these pose an issue, since I play trumpet for a living, and performing at a professional level is difficult to impossible with braces, and having wisdom teeth out would put me out of work for at least a month during recovery. The dentist was told this repeatedly during every visit. I decided to get a second opinion about the wisdom teeth, so I went to an oral surgeon to have them look at it. They took x-rays and looked at the records from my dentist. Then the conversation. Oral surgeon: "So, you're experiencing a lot of pain in your wisdom teeth, according to you record." Me: "I am not. At all. I never have." Oral surgeon: "So, I'm just going to assume your regular dentist falsified the rest of your record too, so I can put this folder down and do my job." He then went on to explain that the way my wisdom teeth came in, they're sitting on a nerve that's next to impossible not to cut in the process of removal, which would leave me without feeling in the lower half of my face for the rest of my life. As you might imagine, this would also be a major issue, given my career. I was advised that if they're not in pain, not to worry about them. I do need to extract an adjacent tooth to one of my wisdom teeth, though, which my regular dentist completely blew off when I asked about it. I never went back to my regular dentist, and will be starting with a new one soon.
MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure.
Bleeding a little.
'Tis but a scratch.
Your whole leg's gone.
No, it's not, it's right over there.
I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. Sad face.
My SIL was fobbed off with the exact same thing. Yum, female severe chronic abdominal pain. Finally referred for a scan which was cancelled because she was low risk. She was again in a lot of pain, so my brother insisted she be checked again, this time by a new physician, who decided to do a rectal check. Diagnosed with colon cancer there, and immediately referred for a scan, then to the best specialist in the area. Chemo, removal of most her bowels, narrowly avoided a bag, and a lifetime of adjustments, but thankfully in remission now. 2 years of being diagnosed with piles instead.
I run into this a lot as a surgeon. Very few primary care providers will do a rectal exam. Just tell the patient that rectal bleeding, probably hemorrhoids, and give them ointment. If it doesn't resolve within a few months, I get the referral for hemorrhoid surgery and find the rectal mass. Either that, or find a colon cancer on the colonoscopy that they should have ordered months ago.
Yup. Exactly. Also a surgeon who has seen far too many fungating distal rectal cancers in patients diagnosed with hemorrhoids for ages.
Any clues as to how a patient would know the difference? I always worry about prostate/colon cancer etc., but was under the impression that if it's frank blood it's hemorrhoids.
A patient might not be able to tell, but a patient sure can insist on a digital rectal exam. It costs nothing to do.
I found a rectal polyp with my finger. Turned out to be a very rare, very aggressive cancer 3 months after the polyp was removed, and I went for the checkup on that surgery. People shouldn't be so afraid of their own bodies. Edit, I am glad to see that a small remark made such a great thread. Maybe it saves somebody, smiley face.
I don't get this fear. If I had new lumps and ass bleeds, I'd be Googling like mad whilst squatting over a mirror for reference material.
In residency I saw a cardiologist miss a STEMI, heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though.
It was obvious on ECG.
It was like textbook tombstones on the ECG, no idea how it was missed.